Hello, hello. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is our first live support group meeting of 2019. It is Friday, January 4th. This is, excuse me, an unscheduled drop-in meeting. Our regular scheduled meeting will be this Sunday. But I always like to come in randomly, see if there's anybody online who might have any questions about IC. So let's see what we can find here. Our dominant topic today, or at least I always do three things whenever I do a live support group meeting. I do about 20 minutes of educational information. I do about an hour or two of taking your questions. And then I usually also have some giveaways. Hello, Tabitha. Nice to see you and Happy New Year to you. Hi, Brenda. Nice to see you. Happy New Year to you. This is an unscheduled drop-in meeting. I'm just curious to see who's on, see how you're doing during the New Year's holiday. I don't know if you can hear it in my voice, but I've had a cold for about 2.5 weeks now. I haven't been able to do any. We'll see if my voice holds up. Hi, Charlene. So what we're going to do is we're going to talk a little bit about cold and flu strategies with the latest research we did. Then we're going to take your questions and maybe have some giveaways. And so if you can go ahead and share on Facebook and on YouTube, let your IC friends know we're doing a live support group meeting. That would be oh so awesome. Thank you so much. Boy, the colds this year are absolutely brutal out here in California. We all got hit over Christmas. Hi, Deborah. Nice to see you. Hi, JJ. Boy, I have no reason to complain about cold weather since you're up in Saskatchewan. I hope that you're having a nice holiday, and I hope that winter isn't too strong for you. Hi, Terry. Nice to see you too. Welcome to the IC Network live iStream. We're going to be doing a lot more live support group meetings in 2019. I may even be doing one a week. I'm really excited about this new format. Patients are really liking it. Doctors are really liking it. I had a doctor call me. It was so interesting. I had a fairly major IC doctor send me an email at 11 o'clock on Christmas Eve. And she was just trying to close down her patient her patient cases for the Christmas holiday. And she called to let me know that there was something on our website that wasn't working. And I immediately emailed her back because I was also trying to close down the IC network for the Christmas holiday. Anyway, she said, call me. So for the first time, I had a lovely long conversation with a doctor on Christmas Eve at midnight. But, you can never underestimate the work that so many people do to try to help you. And whether it is a doctor doing and closing out all their cases at home at 11 o'clock at night, or even the IC network, I'm well known to do all-nighters. I did 3 all-nighters in December, trying to help IC patients. So anyway, this one I want to start with. So if you got our newsletter or if you've been paying attention to our Facebook page, we did a survey earlier this month about cold and flu strategies before I actually got a cold. I normally don't get colds. It was so weird to get a cold. And, we do this about once every 8 or 9 years where we ask patients, can you please share with us your cold and flu strategies that work for you that do not trigger your bladder? Oh, and hey, if you're wondering why I'm bouncing up and down, it's because I'm sitting on my yoga ball. Because I hurt my hip the other day cleaning up. All right. So anyway, so we did a survey. We launched a survey in December where we asked patients about their best cold and flu strategies that would not irritate their bladder. We do this about once every 5, 6, 7 years because there's always a lot of new products on the market. And if there's one thing that patients are really worried about is what cold and flu strategies can you use that will not irritate your bladder? And you can go back on our Facebook page or go back to our newsletter and do the survey if you want. We've got well over 100 responses so far. And I thought I would share the responses with you. And I have some products that I want to help you that I want to show you that I think will really help you. So question number 1 in the survey, what is your favorite over-the-counter sore throat product that you can use that will not trigger an IC flare or irritate your bladder? The answer is honey lozenges, or Ricola lozenges. And so as an example, this is the cold lozenge. This is the cough drop that and sore throat thing that I use to a certain degree. Never irritated my bladder. Naturally flavored, relieves cough, sore throats, gluten-free, no artificial colors, no artificial flavors. I had never tried this one before, and I have to tell you, I loved it. It worked well for me. But remember, I'm IC subtype 5, subtype 3. So I'm central sensitization, pelvic floor. My bladder is pretty good. So some of you may have an issue with the lemon, but most of you probably won't. So I would look at these open nature cough drops. This is by far the favorite of IC patients completing our survey. The number 2 choice was Ricola lozenges. Ricola lozenges got very good review. And the other product that I personally have relied on for years, although it did not get a lot, I don't think a lot of people know about it, is Sucrets. So if you've ever seen Sucrets, it's a throat lozenge that is really good at cutting the sensation of having needles in your throat, which I had for like 5 days through Christmas. And so this would be something else that I would look at. All right. So favorite sore throat over-the-counter products were Ricola lozenges and honey lozenges. Ricola was number 2. Honey was number 1. Sucrets was number 5. But I think it's number 5 because people just don't even know about it. Other ones, chloroseptic spray. 20% of patients said they liked that. Zinc lozenges, excuse me, 15% patients like that. Cepacol, under 10%. All right. And just excuse me, I'm still dealing with this cold. Question number 2, what are your favorite over-the-counter cough products that did not irritate your bladder? And the number 1 winner was Hall's cough drops. Number 2 was Ricola cough drops. Those were by far the favorite of IC patients. The ones that did not do well, Vicks Dayquil only got 2%, NyQuil only got 9%, Robitussin 9%, Robitussin honey cough and congestion 10%, Quercetin 3%, Sambucol 3%, but Hall's cough drops, 25% of IC patients use that very successfully, and Ricola drops 22%. All right. What flavor drops or lozenges work best for you that do not irritate your bladder? And again, the number 1 choice is honey. The number 2 choice is cherry. The number 3 choice is menthol. The number 4 choice was lemon. And we do have some others. Let's see what the others are. Peppermint. Here's somebody who says, I don't take anything that has vitamin C in it, so she can't use Hall's Defense. Here's somebody who says cinnamon and clove. Here's somebody else who just uses pure honey. Honey licorice. There you go. That's a good one. Honey licorice as a flavor would be excellent. Okay. And I will be publishing all of the results for this in our winter IC Optimist magazine, just if you're wondering. Question number 4, what are your favorite over-the-counter products that work for congestion that do not irritate your bladder? The number 1 was Mucinex. The number 2 was Vicks VapoRub by far. Number 3 was Sudafed. However, quite a few of us are sensitive to medications, especially if you're IC subtype 5. So if you're one of those like I am, the odds are you're probably not going to be able to take Sudafed because it's probably going to make your heart race. All right, number 5, you know the cough that just won't quit? What do you turn to when you can't stop coughing? And hot tea and honey, steam hot tea with honey, codeine, Fisherman's Friends, humidifier, chamomile tea with honey, suck on honey flavored cough drops, peppermint candies, Delsim, Mucinex, codeine cough syrup, honey lemon, drink warm honey water. There you go. Lots of fluids and honey, whiskey, and a little lemon juice. I know they are bladder irritants, but sometimes you have no choice when you are coughing like mad. All right, let's see what else we've got here. Question number 6. What are your favorite cold and flu self-help strats? Any surprise secret weapons in your cold and flu arsenal? Somebody says Zicam nasal swabs, Alka-Seltzer cold and flu, nasal saline spray, warm nasal saline spray or ocean spray. You know, a lot of people use neti pots, but you got to be really careful with neti pots. I don't know if you saw sometime this summer or maybe this fall, they were telling the story of a woman who got an amoeba. You know, an amoeba is a living microbe that is normally in dirty water and just normally in water. And she unfortunately used water that had not been sterilized, and she breathed it in and she got a brain-eating amoeba and it killed her. So if you're going to use a neti pot, you have to make sure you use very hot water. I use very hot water through my hot water faucet, which I know is not going to have any amoeba in it because it's kept so hot in our water heater. But you could microwave hot water, you could boil hot water. I mean, you could boil water, stuff like that too. But you want to be careful with like cold or warm, maybe well water, and certainly be very, very careful of drinking water or using water like when you're camping. You've got to be super careful. You should not inhale any of that because there's always going to be living microbes in that water. All right, question number 7. What do you use, if anything, to prevent colds and flus? Number 1, I've got 91 responses to that. I'm just going to go through the first 20 of them with you. Zicam nasal swabs. Here somebody says, I get a flu shot, wash my hands frequently. I also wipe down surfaces with Lysol. I avoid sick people. I do too. You know, have you ever been at the grocery store and you can hear somebody, they walk into your aisle and they're coughing like mad? I look, I turn around and I run. Here's somebody who's Flonase. They use a lot of Lysol around the house. They wash their hands religiously. Hand washing and prayer. I can totally relate to that. Let's see. Question number 8. What is your favorite IC-friendly beverage to eat when you've got a cold or flu? Number 1, chamomile herbal tea. Number 2, peppermint herbal tea. Number 3, pear juice. Number 4, apple juice, rooibos herbal tea. And there's a whole bunch of others also. And I agree with those. I mean, if you've never had hot apple juice or hot pear juice, man, that's really good, especially with a wee bit of cinnamon in it. You might find that it's like a mulled cider, but it's really light, really bladder friendly. People being sensitive to cinnamon it's pretty low overall. So I wouldn't put a lot of it in it, a little bit of lemon. I also put an anise star in mine, and I love anise, which is a licorice flavor. So when patients have colds or flus, that's what they do, man. They go to hot chamomile herbal tea, peppermint herbal tea, pear juice, apple juice. And again, I have a whole bunch of other responses here. Fennel and licorice root herbal teas. I love those. Cinnamon tea. Somebody wrote in here, decaf green tea. Guys, please do not drink any green tea. Green tea, whether it's decaf or regular, is profoundly irritating to the bladder. That's a definite mistake. Let's see, what else do people do? Here's somebody who says they love peppermint. They just can't drink a lot of it because it irritates their stomach. Somebody else who is going for green tea. It's like, guys, no. Don't do green tea in any way. Honey, vanilla, chamomile tea. Excellent choice. That's from a company called Davidson's Herbal Teas. Bouillon, that's good. Be careful with a bouillon cube. They tend to have a lot of MSG in it. So if you're going to buy a consomme, a broth, make sure you get one, if you can, that's organic and or that at least does not have MSG in it. That would really irritate it. Here's somebody who does ginger tea, warm honey tea, little wee bit of ginger ale, elderberry tea, marshmallow root tea. That's a good one. Marshmallow, just so you know, I mean, marshmallow has been around for a long time. It kind of started as what I always thought was a fad about 15, 16 years ago. But there were a couple of patients online who were just loving marshmallow root tea. And so all of a sudden, all these patients started trying marshmallow root tea. And the amazing thing that happened is about 50% of them actually had flares from it. So marshmallow root tea is, if it works for you, great. But if it doesn't work for you, move on and do something else. Question number 9, do you use any aromatherapy products or essential oils for your colds and flus? If yes, what do you use? Most people did not use them. Let's see. Do you use any over-the-counter pain relievers? Which ones do not bother your bladder? And for people with colds, I see patients with colds and flus, Tylenol was their first choice. Advil was their second choice. Aspirin was their third choice. All righty. Have any cold and flu products given you severe flare? And it's kind of all over the place. Here's somebody who cannot tolerate any lemon, stuff like that. So anyway, to kind of sum this up, I'm going to put all the data for this in our winter magazine and on our website probably. But we want to go with honey products. So for a cough, for a sore throat, your number one choice is a honey cough drop, any sort of honey, anything honey. Hot honey, hot water with honey. If you can get a honey candy and suck on it for your sore throat or your cough, those are definitely the most preferred with IC patients, with a follow-up with Ricola drops. And then again, I would encourage you to look at this brand, Open Nature Honey Lemon or Open Nature Cherry. This worked really well for me over Christmas when I had a sore throat like needles or razor blades in my throat for a couple days. All righty. Okay, so let's take your questions, guys. It says, hey, man, it's 2019. Happy New Year, everybody. I really hope that you are going to have a lovely new year. I hope that brings you healing and good health and joy and happiness and comfort and everything you want out of life. The great thing about New Year's is you kind of get to put all the trauma of the previous year behind us. You know, it's very important that we not dwell on the bad things. Let's not dwell on, the trauma of 2018, whatever it may have been. You know, the past is over. It's done. We cannot change it. And we don't want to waste our time thinking about it over and over and over again. Now we want to focus on the future. And, I always end these meetings with, what are the 3 things you can do to help your body? And as you look at 2019, this is even more important. I want you every day to do something for your bladder. I want you every day to do something for your soul, whatever it is, whether it's taking a walk, whether it's going to church, whether it's hiking a redwood, do something that gives you personally comfort. And every day you got to build your knowledge on IC just a little bit. I will tell you that my resolution I successfully completed my resolution for 2018, which was no coffee. And I'm so proud of myself. This is the second time I've done this in the last 10 years where I've decided to have absolutely no coffee for a year. And my only exception was if I look at coffee as, I love it, but I have a tender bladder. I prefer not to drink it, but I still think about it. And I'll tell you, I work like a beast if I have a latte in the morning. My ability to work on the IC network is exponentially better when I have a wee bit of coffee in the morning. That said, I went an entire year without it. I thought about it every day. I even got in my car and drove to Starbucks a couple of times and stopped myself from going in, right? Okay, so I did it. No coffee for a year. So I did have my first coffee on January 2nd and haven't had any since. But again, I'm IC subtype 5, central sensitization, IC subtype 3, pelvic floor. I'm not IC subtype 1 or IC subtype 2, where you're going to be more prone to bladder irritation. Okay. So I've been thinking about what is my resolution going to be for 2019. And I decided on one last night, no ice cream. I'm not going to have any ice cream or any frozen yogurt for 2019 because I gained a little bit of weight last year. And my most important resolution, the one that is how do I say this? I am a slacker when it comes to pelvic floor work. I can be very passive aggressive about doing my physical therapy. I admit it. I can go a week and not do it, and then I get myself into deep trouble, and then I do it every day. I am not as proactive as I should be. And so my resolution for this year is to do my physical therapy every day, which I did before I started this. So those are my resolutions. Be very interesting to hear what your resolutions are for 2019. And do you have any that relate to your IC? So we are simulcasting on Facebook and YouTube right now. And I am ready to take your questions. I don't have any questions on YouTube. Hello, YouTube. I've got Facebook up here. I got YouTube down here. So guys, what questions do you have for 2019? Hello, Julie. Nice to see you, Julie. Heather says she has a cold right now. She's struggling to figure out how not to flare, get your body the nutrients that you need. You know, you got to go back to the basics whenever you got a cold. And that is, you know, make chicken soup, make a bone broth, put some good vegetables in it, keep yourself hydrated, protect your bladder, and you know, again, go to the honey products. Let's see how those do. Hi, Ravonda. Hi, Carol. Thank you, JJ. That's a very sweet. Hi, Barbara. Hi, Betsa. Hi, Stacy. Chris. Hello, Chris. He asked, does SIBO have any relation to IC? And I don't know, hun. You know, SIBO is, and I don't remember exactly what it stands for, except I know that it is a biome disruption in the small intestine. It is a bacterial disruption, bacterial dysfunction of the small intestine. And, you know, God, who was I just talking to? You know, it's a doctor that I was talking to on Christmas Eve, as a matter of fact. And we were talking about all the new biome research that's coming out. And how we're learning so much now about, you know, what are the good bacteria in the bladder? You know, so many people think that the bladder is supposed to be sterile, that urine is sterile, and it is absolutely not sterile. It is supposed to have good beneficial bacteria in it, just like the bowel is supposed to have good beneficial bacteria in it. And of course, we are, my generation, or maybe my parents' generation, well, no, my generation actually was the first generation exposed to antibiotics in the womb because our mothers, you know, were pregnant with us in the 50s and or the 60s, in my case, in the 60s. And so our biome has been so massively disrupted by antibiotic use over time, especially if you are a bladder patient. I can remember in 7th grade when my IC started, they handed me 16 Septra or Sulfa. No, they were Sulfa. And they had me take 16 pills at once. I'll never forget that because it was just so hard for me to swallow pills because I was so young. So we as urology patients are just, if there's any patient population who's been treated with antibiotics over and over and over again, it's us. So to what degree is IC related to a biome disruption? We don't know. You know, is that why Hunter's lesions develop? Is there some sort of biological process that is being disrupted that causes lesions to develop? Or is a biome dysfunction related to central sensitization in some way? We certainly know that biome dysfunction is related to Crohn's and to irritable bowel syndrome. So can we make that same correlation with the bladder? Maybe. And let me give you one example. And I did a blog on it on our website a couple of years ago. It's called the DIP mystery, DIPP. And this was a National Institutes of Health Map Research Network IC study. And what they found using next generation urine testing and next generation testing, fecal testing, not urine testing, fecal testing, is what they found is that IC patients are consistently deficient in important beneficial bacteria. And we have an overabundance of potentially pathological bacteria. And in the bowel, one of the bacteria that we are deficient in, and I don't remember the name of it, but it's in that article on our website, is a bacteria that produces the food that nourishes the cells lining the bowel. Because think about it, you've got cells. All our body needs to eat. Not only do we need to eat, every cell in our body needs to eat. And hopefully we're eating the food that will nourish them, right? But in the case of this specific cell lining the bowel, the human body does not make this food, nor do we eat this food. This food is produced by beneficial bacteria. And this one species of beneficial bacteria. And so when that species is damaged and destroyed by an antibiotic, the cells lining the bowel do not get the food they need and they start to die. So can we potentially say that that same process is happening in the bladder? I think it probably is. I think that there's probably a beneficial bacteria in the bladder itself and in the urinary tract that nourishes the cells lining the bladder. But we don't have that data yet. What we've got is the data of the bowel. We don't have the data of the bladder yet, but I think that that's a reasonable guess to make. So, Chris, in answer to your question, I do think that biome dysfunction, biome dysregulation is far more important than any of us ever realized. And I think in the future, what we're going to start seeing is therapies focusing on restoring the biome correctly. And I also think, and we already have it right now happening, they're going to start treating bacterial infections, not just with an antibiotic, because antibiotics, again, man, that's like taking a flamethrower to all the good bacteria. They're probably going to start treating more and more infections with another bacteria that kills that bacteria. It's a bactericidal treatment approach. So using one bacteria to kill another bacteria, using a good bacteria to kill a bad bacteria. I think we're going to see that sooner rather than later. And I know that it's already been done in some research studies. Chris asks, would cough drops with menthol be kind to people with an IC bladder? According to our study, patients did very well with menthol, except for a few. So I think you just have to try it. Hi, Rhonda. Hi, Cheryl. Carol says you should not use tap water with a neti pot. You should use distilled water. Agreed. Agreed. I agree with that. I personally don't use a neti pot. Stacy says, were you ever able to look at the correlation of a small bladder to IC? No. I mean, certainly some of us have small bladder capacities. And I think that that's I know that there are people watching this right now who have been told that they have a small bladder. I've been told that I have a small bladder. I have been told that I'm holding 30% less than a normal person would hold. Is the organ itself smaller, or is it neurological function? There's something called, when they do a urodynamics test, what they do is so if you've ever had a urodynamics, you lay on the table and they will slowly introduce fluid into your bladder because they're checking to see if the nerves in your bladder are functioning normally. And they're going to ask, as more and more fluid goes in, tell us when you first feel the need to pee. Tell us when you first feel the need to urinate. We call that waking bladder capacity, as compared to anesthetized bladder capacity. If you were under anesthesia, the odds are you're going to hold more. So again, when you're going to have a urodynamics, what they say is tell us when you first feel the need to pee. And then when you get there and you're like laying there going, okay, I need to go. I need to go. They're going to push it a little bit more and they're going to say, okay, tell us when you first feel pain. Laying there going, okay, it hurts. Okay, it hurts. You can stop. It hurts. And then they're usually going to go a little bit farther and then they stop. And then they stop and they drain it out and you're fine. Again, the importance of that exam is that's testing to see if the nerves in your bladder are functioning fairly normally. So what we have consistently seen over time, although I don't remember the exact research study, but it certainly applies to central sensitization, IC subtype 5, is that we have a more sensitive nervous system. So because of that, it's going to take less fluid in our bladder to trigger a need to urinate. So if that is how a doctor is defining a small bladder capacity, that makes sense. That makes total sense. It just may be a neurological, it's not a dysfunction, it's just a neurological sensitization. Awake bladder capacity versus anesthetized bladder capacity. Mandy says she can tolerate more vitamin C if she stays very hydrated. Terry says, are there some types of IC that do not get flares from diet? Yes, absolutely. So let's go over those real quick. Now we know why. Remember, I don't know if you remember 5, 6, 7 years ago, people would have lots of fights online. It's like people would say, well, if you can have coffee, then you obviously don't have IC, right? It's like, no. Now we know that a one treatment fits all approach does not work and a one diet fits all approach does not work. So it's all based upon your subtype. So let's go over the subtypes real quick. And you know what? Let's see. I need to change chairs here. All right. I just need a little bit more back support right now. So give me one quick sec to get myself comfortable. All right. So for those of you who are new, we have long known that a one treatment fits all approach does not work for IC. A one diet fits all approach does not work for IC. Why? Because there's tremendous diversity in the IC patient population. You've got some patients with Hunner's lesions, others with normal bladders. Both could be diagnosed with IC, yet clearly we're different. You've got some patients with terrible pain, others with no pain, both diagnosed with IC, yet clearly they're very different. And when you actually start talking with patients and you ask them how their symptoms began, that's when you see even more diversity. So you see some patients whose symptoms begin after having a baby, others whose symptoms begin in childhood, some whose symptoms begin after a traumatic accident, others whose symptoms begin after chemotherapy. Clearly, they're not all the same in any way, shape, or form. And sorry, this is my colds here, so hold on. I thought it'd be a little optimistic to try to do a support group meeting today, but I think it's worth a shot. So really what doctors have been doing now, IC researchers have been doing for the last decade, is trying to flesh out and understand these subtypes. What are these distinct patient groups? In Europe, there's 16 subtypes established by the European Society for the Study of IC. In Canada, there are 6 subtypes. In the United States, we do not have a formal national agreement on the subtyping system to be used in the United States. However, I use a subtyping system that was created by Dr. Christopher Payne, who ran the IC research program at Stanford University for 25 years and went into private practice with his wife a couple of years ago at Vista Urology in San Jose. And Chris Payne has run the National Institutes of Health IC meetings. He is stellar when it comes to his understanding of IC, and he's treated thousands of patients. So let's look at his subtyping system. Oh, this is not the time to get a nasal drip. Dear goodness me. Okay, IC subtype 1, Hunner's lesions. So these are the patients who have ulcers or lesions in their bladder wall. And I just built a new website on Hunner's lesions over the holiday that I'll be putting on our website with a lot of videos and stuff like that. So this is the one subtype that everybody in the world agrees on, because when you look at these bladders, they have big bloody wounds in them. And these wounds, when you stretch them in a hydrodistension, are known for bleeding. They bleed so much, they call it a waterfall effect. So this is the subtype that is going to have the most sensitivity to diet, because, hello, they've got open wounds. And if you pour acid on a wound or salt into a wound or alcohol on a wound, it's going to hurt them. So Hunter's lesion patients are absolutely going to have the most extreme diet sensitivity. Hey, and Julie Beyer, if you are still in here, please feel free to speak up. Julie Beyer is the first registered dietitian to work with IC patients. She's written 2 books on the IC diet. And if you've got anything to contribute here, Julie, please feel free. IC subtype 2 is bladder wall driven. So these are the patients who have a bladder wall injury of some type. So this is a patient whose symptoms began after chemotherapy, or this is the patient whose symptoms began after menopause for a different reason, or this is a patient whose symptoms have begun after a UTI, or they may have a chronic UTI. Or if they've spent a decade of drinking diet soda or soda and have had a really dysfunctional diet. You know, you got to remember, people, that your bladder was designed for life 5,000 and 10,000 years ago. We didn't have soda 5,000 years ago. They didn't have coffee 5,000 years ago. And it is incredibly optimistic for you to think that your body can defend itself from massive levels of acid. That acid and those other molecular irritants are going to take a toll on your bladder. And here is your bladder from the side. So you've got a coating, a nice thick mucosal barrier. You've got a layer of 4 to 5 umbrella cells, epithelial cells, and then underneath that, you've got nerves and blood vessels. Your bladder is like your mouth. The thing about the bladder that's so cool, and the reason why, like, I never thought I'd be talking about bladder stuff when I was in school, but it's fascinating to me because it's the only organ in the human body designed to hold toxic waste. Because urine is body waste. Urine contains ammonia and urea and all sorts of chemical byproducts. If you're a smoker, there's going to be 20,000 chemicals in your urine alone as toxic metabolites from that smoke. So normally we have a nice thick coating that acts as a barrier that protects the skin from the irritants in your urine. But man, if you're drinking massive amounts of acid, you don't think that this coating is eventually going to start feeling that? It is. It is. And if you're menopausal, you don't have unfortunately, this mucosal barrier is estrogen dependent. So when you're young, you got lots of estrogen, you got lots of mucus. When you're older, you have much less estrogen. That's your body's ability to produce this protective coating is diminished. So guess what? This is when you end up like this, where you've got holes. And urine can penetrate more deeply and reach these cells and injure and damage and irritate these cells and these nerves. So IC subtype 2, absolutely diet sensitive. IC subtype 3, pelvic floor driven. This is the biggest subtype. These are the patients whose symptoms began after a muscle injury, like having a baby or a car accident or a fall or breaking your tailbone, or a history of athletics. If you were an ice skater or a gymnast or a hockey player or a football player or a paratrooper, anything where you took recurring pelvic floor trauma. So in this case, these patients are much less diet sensitive because their dominant problem is muscular. However, there's a caveat here, and that is that if your muscles are so tight that they are restricting blood flow to your bladder, then it's really hard for your bladder to be healthy, right? So, I mean, think about it this way. If you squeeze your arm and you let it go, you can see it turns white here, right? And it's going to take 10 seconds for it to become infused with blood again, or perfused with blood. Is that the right word? Anyway, so when you've got tight muscles, what that's doing is that's restricting blood flow to all the structures in your pelvis, including your bladder. And you can see that because, look, we've got blood vessels down here. Well, those are nerves. You see the blood vessels right there. Eventually, because your bladder is not getting good nourishment, your bladder is going to start to break down and not heal as well as it could. And so pelvic floor patients might be modestly or moderately bladder sensitive and diet sensitive, but it's really not because their bladder wall is damaged as much as it is because their bladder just cannot be healthy because it's not getting good nutrients. Okay. I see subtype 4 is pudendal neuralgia. So these are the patients, they don't have a bladder injury. They don't have a muscle injury as much as they have a nerve injury. Their symptoms are very positional. So they're fine when they stand, but when they sit down, it hurts, or when they bend over, it hurts, or when they squat down, it hurts. And in this subtype, again, they're really probably not going to be as diet sensitive, but they're having underneath all this nerve compression is tight muscles. So there can be a little bit. And then I see subtype 5, central sensitization. We are the group, and this is my subtype, where we have systemically sensitive nerves, and we inherit them in many cases. So we have very sensitive skin. We are drug sensitive. Normal doses of medications are often too strong for us. We have to take half doses, pediatric doses. We are food sensitive. There are some foods that just don't work well for us. And not just for our bladder, but for our bowel. Like for me, I cannot eat chocolate and I cannot eat oatmeal. I just can't. It hurts. We have a wicked sense of smell. We can smell things that other people cannot smell, and smells really have the potential of driving us crazy. And we also tend to be very chemically sensitive. And so for this subtype, there are going to be some foods that trigger that sensitivity. But like for me, I can have coffee, okay? But it's not again, because my bladder is healthy, and we know my bladder is healthy because during my hysterectomy, I had a hydrodetention. So we know my bladder wall has no injuries on it. So I can definitely have coffee. But what happens is if I do it every day for about 2 weeks, all the nerves in my body start getting amped up from the caffeine. And that's even decaf. I don't drink caffeinated coffee, decaf. So what happens with me is slowly but surely, all those nerves become even more sensitive and hypersensitive. So I protect my bladder, and I avoid those things that I know are going to be more irritating for me personally. So Terry, I hope that answered your question. So the fact that you don't get any flares from your diet tells me that your bladder wall is probably in pretty good condition. And that really points instead probably to your pelvic floor as your dominant problem. Michelle asks, is elderberry okay? And the answer is yeah, usually elderberry is fine. Cheryl says she doesn't like coffee, but her demon was diet soda. Yeah, and boy, if there was ever a demon in the food world, it is diet soda. It is terrible. Terry says she follows a diet for migraines and that she certainly has triggers with some foods. Kathy says, why not do the low acid coffee? Well, some people can do the low acid coffee. We've got some excellent low acid coffees. I can do low acid coffee for sure. But a Hunter's lesion patient should not be doing really any coffee. That's going to be, I mean, if they've got open bloody wounds in their bladder, seriously, if you had an open bloody wound on your hand, would you pour coffee on it? No, because your job is to create an environment that will support healing of your bladder. So it's all about wound care, right? So what would you put on a wound? Water, or maybe milk, maybe chamomile herbal tea. You got to protect that wound and give it some opportunity to heal. You know, I do have as demos here. I was going to make a video about coffee. I can show you some of the low acid coffees if you're interested. Tyler's Tyler's, they say acid-free. It's not really acid-free. If it were pH 7, it would be acid-free. It's pH 6 point something. So there's a wee bit of acid in Tyler's coffee, but it gets pretty good reviews. Let's see, what else do I have in here? So Tyler's has K-Cuts. Tyler's has regular ground coffee. Where is my Simpatico coffee? Another brand is Simpatico. We've been selling that for years through the IC Network store. Lots and lots of patients use it. But I have a new favorite coffee that I recommend to IC patients who want to try drinking coffee again. And it is called Bella Rosa coffee. The reason why this is the lowest in the industry is they created a custom roasting process that coincidentally reduced the levels of chlorogenic acid. And chlorogenic acid is the most irritating acid in coffee. This company, the engineer who created their roasting process, did something magical in a way. They didn't know that they were doing it, but when you roast beans in hot metal, it produces chlorogenic acid. If you roast beans with air, you don't get the chlorogenic acid to that same degree. And there was something about the way these guys did it that made the chlorogenic acid virtually nil. And it's such an interesting story because when they launched this coffee, and they have several different types, they have a decaf, they have a half calf, they have a full calf, they have lots of different varieties. One of the things that they got from their customers is, I don't know why, but I can drink your coffee and it doesn't give me any stomach aches. Can you tell me why I can drink your coffee? I have no clue why. And they didn't know either. So they sent their coffee up to UC Davis, University of California, Davis, to a very famous coffee researcher. And he's the one who discovered that Bella Rosa coffee has virtually no chlorogenic acid in it. And that's the harmful acid. So that's the one that we tell patients to try, is a Bella Rosa. And you can find that right in on the IC Network website under coffees. Okay. It's in our shop. All right. Carol. She's been 2 weeks, sick for 2 weeks after having a colonoscopy and ended up with thrush. Girl, holy moly. You've been drinking a lot of chamomile tea and decaf green tea. Okay, you gotta stop the green tea, hun. The green tea is really irritating to the bladder. It's very, very acidic. If you can let that green tea go, I think you would feel much better. If you're having a flare, that's probably from the green tea, hun. Green tea's brutal. Nancy asked, why does bladder pressure and the feeling of a need to go happen? That is coming from, so you've got two different nerve groups in the bladder. You've got the alpha afferent nerves, which control frequency, urgency, and you've got the C fiber nerve, which controls pain sensation. So here you go, right down here in green, we've got the alpha afferent nerves. So the first nerve that gets turned on anytime you have a bladder injury is the alpha afferent nerve, because that's a nerve that tells you when you need to pee. So anytime you have any sort of bladder insult, whether it is a flare from coffee or whether it's an infection, whatever, or chemotherapy, the first symptom you're going to feel is feeling like you need to pee. And one of the things that's even more interesting is a false sense of fullness. So let me describe a flare and let's see if you can relate to this. Okay. So for me, when I was having flares, 15 years ago, go to bed at 10. Obviously you pee before you go to bed, wake up at midnight, your bladder feels very full and you pee out maybe a quarter cup of urine. You go back to bed, you wake up a half an hour later, your bladder feels very full. You go to the bathroom, you pee out maybe a teaspoon. You go back to bed, you wake up 15 minutes later, your bladder feels very full. You go to the bathroom and you start pushing and you might get a drop or two. It is that false sense of fullness that tells you that the alpha afferent nerves and the bladder wall is very, very irritated. Now, so that feeling of the need to go absolutely is coming from the alpha afferent nerves. Pressure is a different story. Sometimes tight pelvic floor muscles can also cause pressure. Tight pelvic floor muscles don't normally trigger frequency urgency to any great degree, but they can certainly trigger a sensation of pressure. But also that false sense of fullness. If you feel really, really full, but you know you haven't had a glass of water in 2 hours, you know that it's physically impossible for your bladder to be full, that points to super, super irritated alpha afferent nerves. So bladder wall irritation. I'm just going through your questions. Feel free to ask questions. Hey, YouTube, we've got 3 users on YouTube. If you've got a question, feel free to ask. Miss Manda has been doing some IV treatment for ESBL. She thinks that her kidney stones are harboring the infection. Well, we certainly know that kidney stones are covered with bacteria. And that even more research was presented at the 2018 AUA meeting about that. So you could absolutely be right, but you absolutely need to go back to the urologist and your doctors and let them know that you're not doing well. Let them know that you're very, very sick and you need help. That's very, very complex, but it's fixable. It's doable. Don't you dare give up, hon. You got to ask for help. Nancy asks a really good question. She says, why when it's time to sleep, my bladder pressure starts and I can't fall asleep? It's getting to me. So Nancy, that's when we just don't have a lot of distractions during the, at night. I have the same problem. Guys, I'm trying to fix my window here. Hold on a sec. Is that better? Playing with lighting is always really hard. I don't know. All right. Okay. See, that's all right. Is that better? Hold on. Is that better? Hold on. No, that's worse. Oh my God. Hey, man. I didn't go to theater school. I don't know how to do lighting. I'm trying. Okay. Anyway. Hold on. Let me just try one more thing. I've got this new light. Oh, okay. There you go. That works. All righty. Sorry for the entertainment there. Okay, so why do you feel more bladder pressure when you go to sleep? Number one, you just don't have the distractions during the day. I have the exact same problem, believe it or not with my bladder, but with my left piriformis muscle. I am fine during the day most of the time, but as soon as I lay down, I feel it start to flicker. And sometimes it drives me crazy. I was up for 2 hours 2 nights ago with it. Finally, man, I just got the Flexeril. I got some cyclobenzaprine as a muscle relaxant and use medication, try to get myself together and to get a little bit of sleep that night. So number one, we're going to look at the fact that you don't have distraction. We just wrote a really good article in our magazine on sleep strategies. I would suggest that you look at that. But really that nighttime irritation is almost a direct reflection of what you've done that day. So if you started that day with a cup of coffee, if you did something that day that maybe you shouldn't have done, sometimes you don't feel that flare until you try to go to bed because it starts to be really subtle. I wrote an article years ago called Anatomy of an Utterly Ridiculous IC Flare. And it was, God, what did I do? I started the day with, I think, I went out for breakfast and I had eggs with a little bit of salsa on it. Now, this was back when my bladder was really bad, right? That by itself was fine because I never do a lot of anything like that. But then I had a smoothie with pineapple juice, which of course I don't do now. So I had 2 strong acids. And then at dinner that night, I had something tomato-based. You know, because again, we didn't know about diet back then, right? You can't blame me for it. We didn't really know about diet. Oh my God, I did not sleep that night. I didn't feel it until I tried to go to sleep. And I had a wicked IC flare for a couple of days because I did 3 strong acids. So look at what you've done that day. And that may contribute to it too. And go back and look at our fall 2018 IC Optimist magazine. Stacy Shannon wrote a wonderful article that gave a lot of strategies to help you improve sleep. And certainly you got to put your iPhone down. Don't bring your iPhone to bed or your iPad to bed and start looking at that. We're really learning a lot about blue light and how blue light wakes your brain up. Red light helps you go to sleep. If on your computer, you're going to notice that there are daytime settings and nighttime settings, and it will automatically adjust. And as you go to nighttime, things get redder, yellower and redder and oranger. And that's purposeful. That's purposeful because blue keeps you awake. Reds and oranges help you go to sleep. Think about dawn and dusk. At dusk, things turn red, and that triggers nature to go to sleep. And that's kind of the same way we look at light there. Erin, girl, the first person to actually be watching a support group meeting while she's getting a bladder installation at her doctor's office. Woo! I bow to you. Good job. I'd like to know what kind of installation you're getting. And boy, wouldn't that be a great live cast? God, would I be willing to go online with my iPhone broadcasting while they're doing a bladder install? Oh my God. Yeah, I would probably do it. If I needed it, I would do it. I think it'd be interesting. Hi, Marianne. You guys, for those of you who signed up for coaching, I haven't done any coaching yet because this is like the first day that I'm actually been able to talk more than 10 minutes without coughing. So Marianne, anybody who needs to get in touch with me, all you need to do is email me at, this is my super secret email address, icnetwork@mac.com. So the best way to get in touch with me is to email me here or to call our phone. You can call the phone line and go to the corporate office. Or do the support phone line because I'm usually answering the support phone line unless I'm sick. Like I'm sure I've got 20 phone calls to return there. But 800-928-7496. I do the best I can, okay? So that's the best way to get a hold of me, hun. And then once we email, we can Skype. I talk to Australia all the time, New Zealand, so it's not a problem. I'll just be up at midnight. Cheryl says her doctor told her she had a lot of scarring from inflammation over the years and a reduced bladder capacity. Yeah, that can happen, especially if you got Hunter's lesions and they've been fulgurated. So Maureen says, I was diagnosed 20 years ago. I have bouts every now and then. I'm having one right now that has lasted for 3 days. Have they come up with anything new for severe pain? So Maureen, here's the deal. Everything that we knew 20 years ago has changed. We don't think of IC as a bladder disease anymore. We think of it as a pelvic pain syndrome. Why? Because we know that there are structures beyond the bladder that are usually involved, but we also know that aging can play a role. So one of the things that you've really got to focus on, given the fact that it's been 20 years, is that you are probably now menopausal. And because you are in menopause, as I am too, surgical menopause because of a hysterectomy, what that means then is you and I don't have a lot of coding. anymore because we don't have a lot of mucus anymore. And if you've gotten into the habit of drinking that 1 cup of coffee a day, thinking it's okay, you might have been able to get away with that in your 30s and your 40s, but you might not be able to get away with that in your 50s, 60s, and beyond, simply because you just don't have as much of a coating. So generally what we see over the holidays like this is we see a group of patients who, you know, they live it up during the holidays, not understanding that their bladder, their bladder's ability to defend itself has changed in the past year, and it might have become more vulnerable in the past year. So the question that I ask when I work with patients having flares is this one. This is the question that will help us determine what type of flare you're having. So when is your pain the worst? Before you pee, while you're peeing, or after you're done peeing? If you feel worse as your bladder is filling up with urine, so the fuller you get, the worse you feel. And as soon as you pee, here, hold on a second. Nope. Okay. As soon as you pee, there's a sense of relief. So the fuller you get, the worse you feel. But when you empty your bladder, you feel better. That is a bladder wall flare. So what that means is that your bladder wall is compromised for some reason. Could be diet, could be estrogen atrophy, could be infection. Of course, for moments like that, it is absolutely reasonable to do an azo strip, test strip. Pee on a strip. Let's see if you got any nitrates. If you got nitrates, you got infections. We want to rule out infection. We want to rule out estrogen atrophy. If your vulva's dry, your vagina's dry, then so is your urethra and so is your bladder. So estrogen might be reasonable for you. And we also want to look at chemical irritation, backing off on chemicals that might have provoked your bladder. If your pain is worse while you're peeing, especially in your urethra, then we're going to be looking at estrogen atrophy or UTI. If your pain is worse, not before, not during, but after you're done peeing, we're really looking at muscles instead. If you go over to the IC network, ic-network.com, and sign up for our free newsletter, which only goes out once a month or once every 2 months, you can download our 40-page flare management guide that has an hour-by-hour rescue plan for each type of flare. So again, pain before urination, bladder wall. Pain during urination, we're looking at infection or estrogen atrophy. Pain after urination, we're looking at muscles primarily. That's of course, people can be freakily different, right? So, but that's kind of the general rule book for flares. Laura says she had a really bad bladder infection that was hard to get rid of. Ever since then, she's had terrible groin pain. Urologist, orthopedic doctor, osteopath, pelvic floor physical therapy, acupuncture. Nobody has a definitive answer as to why I'm in pain. Do you have any insights? Laura, I'd love to talk with you. What I would really like to know is, where is your pain? Is it always in the same spot? Is it to the left of center? Is it to the right of center? Is it low? Is it high? Is it external? Is it internal? So saying groin pain, that's too vague. We need much more specifics to try to figure it out. Okay. Sherry says that you're having a urodynamic test was the worst pain experience ever, but it was in the 80s. Yeah, they don't do that like they used to do that anymore. You don't need to be afraid of it. And you know, guys, I mean, I'm just going to say it right here. You got to remember that you're the boss. They're not the boss. You're the boss. You pay them. They don't pay you. And before you agree to have any major procedures, especially procedures where you are awake, like a urodynamics, you need to look that doctor in the eye and say, now listen, if I say this word, I am telling you that we're done. You may not push me further. I think it's important to have a safe word because, you know, remember, doctors, there are a lot of doctors out there who have never had bladder pain. They don't know what they you know, doctors, they have wonderful training, but they diagnose by observation. They cannot be inside your body and experience how you feel. And there's only one doctor that I know of who is willing to actually damage his bladder so that he could understand what IC patients feel like. And that was Chris Payne, where he put protamine in his bladder. And I think it was protamine. And I think, don't quote me on that. But anyway, he lasted about a minute or two before he drained it out because it hurt so bad. So I am very assertive about negotiating a safe word. I'm willing to give it a try. I'm willing to give them a shot to look at it. But for something like a urodynamics where they're pushing past pain, they need to respect me. And if they're not willing to stop when I tell them to stop, then that's probably not a doctor that I'm going to want to do much more with. Marianne says she has Hunner's lesions. So Marianne, girl, I hope you're getting your lesions treated correctly. They need to be cauterized, laser therapy, steroid injection, or Lyris. Those are the treatments for lesions. Ooh, Kathy has bilateral pudendal neuralgia. Kathy, do you know why? Do you have a muscle injury? You have a lower back injury? Miss Manda says, what about people like me with constant IT, UTI, kidney infection, stones, E. coli, and urine? You know, technically, Manda, you are excluded from a diagnosis of IC if you have positive urine cultures. That was a critical part of the early diagnostic criteria for IC, which was, I think, was in 1987 when the National Institutes of Health created their first diagnostic criteria for IC. And they specifically said any patient with active UTI would not be diagnosed with IC. They would be diagnosed with infection, UTI. So in your case, you've got kidney stones, E. coli in your urine, getting ESBL. You are the perfect candidate for next generation urine testing because the odds are you have got a pretty wickedly drug-resistant E. coli that they're having trouble killing. So if you've never heard of this, next generation DNA urine testing, you go to a website, bladderhealth.org, and you can watch a bunch of videos. I built this website this summer. You can watch a bunch of videos of doctors explaining how they use it. You know, those typical urinalysis, urine tests, it turns out really only grow out 1% of the potential bacteria in your bladder, both good bacteria and bad bacteria, and they certainly do not grow out candida or yeast. Next generation testing does not try to grow anything out. Instead, it looks for DNA. It will identify every living being in your bladder at any given time. So it will identify good bacteria, it will identify bad bacteria, and it will identify candida and fungus in your bladder. But what's even more important than that is they can then, based upon that DNA, tell you what drug resistance genes are in that bacteria. And that's important. So, you know, when you do a typical urinalysis, they do antibiotic sensitivity testing. And basically, I did this for my senior project when I got my pharmacology degree. I isolated bacteria in water fountains and hospitals and other places around campus and in hospitals. You've got a round plate with a growth medium in it called agar, and you put the water on it and you wait 24 hours and you see if anything grows. And if there's bacteria there, certain bacteria, it will grow. And then what you do to see which antibiotic will kill it, you put little round discs of paper soaked in antibiotic on top of those living cells, and you come back another 24 hours and see which one killed it. So that was the technique that has been used for, decades. Next generation DNA testing is so much better than that because we now have giant databases of bacterial DNA at our Center for Disease Control and our National Institutes of Health. So they don't need to try to grow anything out. They just throw the DNA they found into the database and they will find the matching antibiotic resistance genes. So if I were you, Miss Manda, I think this would be something that I would strongly consider. Since you keep getting recurring E. coli, why not find out what strain of E. coli? Why not find out if it's got any resistance genes in it? And this test will do it, and it's only $199. The reason why that's important is, especially for those of us who have limited health insurance, it could cost you $1,000 to do gram-positive versus gram-negative versus candida. You have to do them all separately if you're doing the old technology. This, you get it all in one fell swoop for $199, which is a deal. I mean, but God, that's the wrong word to use. It's not about a deal. It's about, I'm very evidence-based. I'm very data-based. I don't want anybody guessing about my health. I want the facts. If I'm in pain, I want somebody to look at it. I don't want to call a doctor on the phone, say, hey, I'm having pelvic cramps and I'm spotting. What do you think? Which I did. And we missed uterine cancer for 6 months because I was foolish enough to, and I was afraid to have the biopsy, right? Which is so unlike me. I'm not that way, but I did it. I let fear stop me. That's a whole nother story. But if I'm in pain and that pain is persisting, I want somebody to look at it, study it, give me the data, do a test. Don't guess, do a test. And that's why this next generation testing is so important, because it is the quintessential test to determine if you've got any dysfunctional bacteria and any fungi in your urine that could be contributing to your symptoms. So I'm evidence-based. I like the facts. I don't like guessing, for me and for you. Robin, how can you find out if you have pudendal neuralgia? Number one, Google it. You don't need to Google it. Come on over to our website. You can read about it. You've got pudendal neuralgia if you've got nerve pain. So if it feels like you're being shocked or you're having a quivering sensation, that also is a sign of potentially pudendal neuralgia. Your symptoms are positional. You're fine when you stand, but when you sit down, it hurts. And another symptom for some IC patients with pudendal neuralgia is PGAD, or persistent genital arousal disorder, where the pudendal nerve is being inflamed and or compressed, and you get this kind of hurts, a painful arousal sensation. And it's one of the dirty secrets of IC, because it's one of the things the patients simply don't tell their doctors about, because they don't want their doctor to think that there's anything sexual going on. But it's a very distinct, painful arousal sensation. I know, because I had it for about a month, and it was very creepy. And it's just kind of this hurts so good, hurts so bad sensation, but it hurt so bad, so much more than anything even slightly arousing about it. It was uncomfortable, deeply uncomfortable. And in that case, you need to tell your doctor you're having that symptom, and they can do a nerve block. And the nerve block is the de facto diagnosis for pudendal neuralgia, along with if they find tight muscles as a given, based upon your symptoms. Marianne says she thought berries are mostly high acidic. No, that's not true. A ripe berry, the more the sugar, the more the sugar rises, the less acidic it gets. So when you're eating fresh, ripe blackberries, the acid level is going to be very low. if you're eating unripe berries, the acid levels are going to be much higher. But the real issue with berries is oxalates. There are some berries that are higher in oxalates. Oxalates are irritating crystals. People can get calcium oxalate kidney stones, which are very sharp. So some patients have to keep their oxalates low because the oxalates irritate. And berries are high, specifically strawberries, raspberries tend to be higher in oxalates than, say, a blueberry. Steve and Bambi Linker, Bambi is asking, are there certain creamers that are IC friendly? Mocha Mix is one I use regularly. It works like a charm. I tend not to get the flavored creamers because they tend to use a lot of extra preservatives in there and acids in there for that flavor. So I personally just go for a plain Mocha Mix, or, you know, how about just milk? How about a low-fat and non-fat milk? Kathy asks, how can you find a copy of this video? It'll be on YouTube. All of our videos are stored on YouTube and on Facebook. We simulcast. I'm going to start Twitch streaming probably next month. So we'll be doing it on Twitch so that I can show you my desktop and so that I can walk you through important pictures and things like that. Hi, Natica. Natica is from Bangkok. Hello, Bangkok. How can we fix frequency urgency? How can we fix a destroyed lining? Well, Natica, number one, you always have to remember that healing is always happening. Your bladder right now is trying to fix any damage that is happening to your bladder. The challenge is we often get in the way. So this is a three-dimensional picture of your bladder wall. So we've got a layer of mucus. Remember, your bladder is like your mouth. It is a hollow organ covered with mucus. It is supposed to be wet on the inside. It's just like your vulva. Your vulva, your vagina, is supposed to be wet. Your mouth is supposed to be wet. Your bladder is the same way. That wetness, that mucosal barrier, protects the skin from any irritants in your urine. So we've got a layer of mucus, 4 to 5 layers of urothelial cells, and then underneath that, we've got nerves and blood vessels and other structures. So the odds are that something that has happened that has damaged your bladder lining, and if I tilt this back, you can see when you don't have a normal bladder lining, the constituents in your urine reach where it's not supposed to go. So number one, I don't know how old you are, but we're going to follow the IC diet, protect your bladder. It takes about 2 weeks for one of these cells to be replaced. So you cannot change your diet for a week and expect to get better. It takes 2 weeks for just one of these cells to regrow and to fill in any damage. So you got to follow the diet for, you know, ideally 3 months, 6 months. Give your bladder an opportunity to repair itself. You shouldn't be cheating at all with any coffee, green tea, soda, anything like that. And your bladder should be able to regenerate that bladder lining. Okay, the only time that gets more challenging is if you're older and you're menopausal, because you don't have a lot of estrogen and your body needs estrogen to produce some of that bladder lining. Ruth, why does my bladder burn after a bowel movement? Because it's not your bladder, hun, it's your pelvic floor muscles that are burning. Your pelvic floor muscles are burning. So the odds are you probably pushed and strained to have your bowel movement. And anytime you make muscles work, they build up lactic acid and that causes a burning sensation. Don't you remember, like I can remember, I think it was in my 20s when I was just starting to get irritable bowel that I strained and strained and strained, like, because I didn't know any better back then. And I remember my pelvic floor muscles aching for a couple of hours because I pushed so hard. I would suspect that you're pushing too hard and that your muscles are working hard, or you already have very tight pelvic floor muscles in the first place. You might have pelvic floor dysfunction that has not been treated. Kathy asks, What kind of bladder installations do? I don't do any. My bladder is a happy bladder these days. My pelvic floor muscles are, I want to say the F word. My pelvic floor muscles, on the other hand, are blanked up. My pelvic floor muscles are my dominant problem. So I don't need to do bladder installations. The bladder installations that are the most popular right now are rescue installations with heparin and lidocaine, or Elmeron and lidocaine. Most of the other bladder installations are not done. Chlorpactin, silver nitrate are not even mentioned in the AUA guidelines as a treatment for IC. Do not do them. They are not recommended in any way, shape, or form. And DMSO is falling out of favor rapidly, in part because DMSO looks like it's being discontinued. At least it has been discontinued in Canada. We do not know if that is going to happen in the United States. DMSO has other issues. It can cause a burning sensation. It can cause a garlic-like odor. And we now know that DMSO, when used at the FDA-approved dosage of 50%, can also cause an irreversible bladder spasm. And that was research that was presented at the American Urology Association years ago. You can find all that right on our website in our discussion of step 2 treatment options. So go to ic-network.com and you can learn more about bladder installations. Hello, Dr. Gio. So nice to see you. I don't know if he's still in here. Gio Espinosa is the Director of Integrative Urology at New York University. He is also a holistic practitioner for IC and prostatitis and pelvic pain. And he is the doctor who created the next generation supplement that is now one of the most popular supplements called Cysto Renew. Very nice to see you, Gio. And his blogs are awesome. Go to drgio.com and sign up for his blog. He's got some good info out there. Radu asks, what do I drink now? I drink, rooibos tea. This is a pumpkin spice rooibos tea that we sell. And I drink hot water, and I drink, hold on. Oh, I already put my trash out. I drink a sparkling water, LaCroix sparkling water, raspberry and flavored and mango. That's pretty much what I drink. And lots of water when I can. April says her pain is left of center. So let's do a little demo here, right? Okay. So here are the top of my legs. So obviously my pubes are right here. My bladder is right here. My hip bones are right here, right? Oops. This is, it's not torn. It's just the way this is designed. All right. So we're talking bladder, hip bone, hip bone. So what you're saying is that your pain is to the left of center. So what that probably means is that you've got something to the left of center that is triggering your pain, and it's probably your pelvic floor muscles. That's where I get my pain. My pain is to the left of center, but it's on the back. So like here's my sit bones right here, right? And my pain is in an arc right here. And that, my friends, is a seriously screwed up piriformis muscle called piriformis syndrome. It drives me crazy. All right. JJ says 2 ladies that he knew had lesions cauterized, and it really helped them. Awesome. Yeah, it can. All right, guys, we've got 11 viewers on YouTube. Hello, YouTube, but none of you have asked any questions yet. At least I don't. Wait, hold on. Hold on. I want to make sure I didn't hide them. Oh my God, I hid them. I'm so sorry, YouTube. All right, so hold on. Let me take some questions from YouTube. Let's see here. Hi, Donna. Hi, Debbie. Hi, Marty. Marty, is a cranberry supplement always bad? Yes. Yes, it is always bad. I mean, if you have, because cranberry in general is just incredibly highly acidic. It's not something that we suggest to anybody with IC subtype 2 Hunner's lesions or IC subtype 1 Hunner's lesions or IC subtype 2 bladder wall driven. If you have a history of E. coli based infections, that's when quote unquote cranberry makes a little bit more sense, but you don't have to take the cranberry. You can use D-mannose. D-mannose. A D-mannose is the sugar found in cranberry that the human body does not use that happens to bind to E. coli. And so when you eat D-mannose, your body doesn't use it. It is immediately flushed into your urine. And it happens to have a receptor on it that matches an E. coli receptor, and they attach and you pee it out. So if you have a history of E. coli, you can try D-mannose. And we have that in our shop. You can buy it online. But in general, we like to stay away from cranberry products. Oh my God, we have a bunch of lurkers on YouTube. All right, guys. Yes, William, I don't believe you. No, I'm not sexy. No, Lucy, you may not have my glasses. Yeah. All righty. Clearly, this is the first time we've had people doing saying even improper things on YouTube. My goodness, people. Yeah, hold on a sec. I just got to deal with this. I'm putting you on timeouts, people. Oh, all right. This is why we need moderators. All right, let's go back to Facebook. Hold on a sec, guys. Let me just deal with this real quick. That sucks. Facebook, you guys, just hold on a minute. We got a situation over here. We got some people being stupid. Oh, the joys of the internet, right, babies? Right? Ridiculous. My goodness. All right. I think I took care of that. We'll see. All right. Okay, let's come back to Facebook now. Sorry about that, guys. You know, most streamers have moderators who actually go in and prevent stuff like that from happening. You know, the joys of the internet. Marianne says she constantly has E. coli UTI, so the next generation testing sounds like a plan. You bet. I would definitely do it. So Natty says when she goes in for bladder pain, the urinalysis doesn't show UTI, but it does show microscopic blood. And she doesn't know what that means. Let me explain to you what that means, okay? I mean, it's really a basic lesson in biology here. And just hold on a sec. So, let's think about it this way. Biologically, what happens when you get a splinter? So when you get a splinter, you've got a foreign body lodged in skin. Now, a splinter isn't infection. A splinter is an injury, right? So how does your body respond to that splinter? The nuance of the human body is absolutely amazing. So basically, the inflammatory process begins. Your body knows something is there that shouldn't be there. It is assuming it's perhaps infection. So it's sending leukocytes. It's sending white blood cells to the area. And those white blood cells arrive in blood vessels. But the splinter's up here. The splinter's not down here. The splinter's up here. So how do the white blood cells, the leukocytes, your body's own warriors, how does the white blood cells get up here to fight whatever it is? The answer is your capillaries let them out. Your capillaries open, and it releases them. So when you have a flare, let's say you've drunk coffee or something else that is really irritated here, the leukocytes travel to that area. And when the blood vessels release the leukocytes, the blood vessels also release red blood cells. And that is why I see patients often have microscopic blood in their urine. That's very different, though, from visible blood. As I was working with somebody yesterday, she was peeing blood. If you're peeing blood, you've got pink urine or red urine, that's an emergency. That is urgent. You have to call your doctor and let them know that your toilet is red. But that little occasional hematuria, visible hematuria during an IC flare, and or when you do a azo test strip, if you're positive for leukocytes, but you're not positive for nitrates, that really just usually means you have a flare. Now, there are always exceptions to the rule. So if you're worried, then you call your doctor and you go have the test and you ask them. Microscopic blood visible blood is also a potential sign of bladder cancer. And or a bleeding Hunner's lesion. So if you have visible blood, you should call your doctor and say, listen, can you just test me and let's just make sure I don't have anything else going on? And the odds are, as part of your diagnostic process, you've already had what we call a urine cytology to see if you have a risk factor for see if you have early evidence of cancer. But if you were a smoker or you are smoking and you've got visible blood in your urine, then you really need to follow that up, because I don't want you to have bladder cancer and deal with that. The good news about bladder cancer is if you catch it early, it's really easily curable. But if you wait and wait and wait, you could have other issues. Okay, so we don't want that to happen. Marianne says, what causes urethra burning? I have a really good article on our website called The 7 Causes of Urethral Irritation. Marianne, come on over to our website and search for that. Basically, urethral burning, again, this three-dimensional, this is also a good three-dimensional for your urethra. Your urethra is often the first to react to the loss of estrogen. And so many women who are menopausal, I'm really starting to feel the impact of that menopause is going to have issues with urethral burning because they just don't have that normal protective coating of mucus. Becky says she thinks her IC is because of mast cell activation syndrome. And we have certainly seen mast cell activation syndrome in the bladder in some IC patients, at which point in time you're going to be working with different mast cell therapies and or antihistamines like hydroxyzine, which is a common medication prescribed for IC patients. Sarah says she'd like to know how much success patients have had with caudal infections. I don't have any data for you, hon. I don't know. Cheryl says she took methotrexate for psoriatic arthritis. Could that have done damage to my bladder? I don't know. I mean, let's look. Hold on. See, this is why I'm going to start streaming so that you guys can see what I'm doing. So hold on a sec. Let's see what I can find. Let's see here. Let's see what WebMD says. Common side effects to methotrexate: bleeding of the stomach or intestines, a hole in the intestine, inflammation of the stomach and intestines, sepsis. So if it can cause bleeding in the gut, there's pretty good chances it could potentially also cause some bleeding to the bladder. But that would be a really good question for your pharmacist. I mean, I think you can make that case. It can cause kidney disease, kidney failure, inflammation of blood vessels. Yeah, that's rough. It's a rough med. Bloody urine if experienced, these tend to have a less severe expression. Bloody urine is a known side effect of methotrexate. All right. So you are right, my dear. You are right. Hello, my sister who just logged on. Hi, sis. Grapefruit extract is great to kill bacteria in the bladder. Google it. I'll look it up. We certainly don't want you doing the citrus juice from grapefruit. That would be quite irritating. If you have any, Karen, if you have any data on that, I would really love for you to send it to me. I'm very into alternative and holistic options for IC. That might surprise some people, but that is very, very true. Alfalfa tabs, I have no data on that. I have no information on that, nor do I have patient testimonials either about grapefruit extract or alfalfa tabs. Remember, Karen, with IC patients, we really are looking instead at injury or trauma to the bladder rather than bacteria in the bladder. There's only a small subset of IC patients who might have chronic infection, and that's the group that perhaps that might be helpful for. But for the rest of us, grapefruit extract, especially for somebody with Hunter's lesions, I think would be a mistake given the high citric acid level. Ruth says, why does my urethra burn after a BM? And the answer is, again, muscular. I bet it is. I bet that's all a muscle cascade, hun. Jennifer says, you're positive for leukocytes and nitrates, but your culture is always negative. So, girl, that's when you do this. What that tells me is the culture just can't grow it out. So do the testing that will find it, which is the next generation urine test. I mean, this is such a gift to the IC world now and the urology world now because, I mean, remember this tremendous diversity in the IC patient population. We absolutely have a lot of patients where this is muscle injury and it has nothing to do with infection. But there is definitely a population of patients, a small population of patients where an undiagnosed or a misdiagnosed infection could be playing a role. We see that also with Lyme disease. We now know that many patients with Lyme disease have bladder symptoms because the Lyme bacteria arrives in the bladder. So doing something like this can at least give you a baseline of what is currently active in your bladder that might be useful as you talk about this with your doctor. Ruth says she wishes she could take me to the doctor appointment. Yeah, you know, I might have more on that later. We'll see. Hello from Newfoundland. Hi, Donna. Nice to see you. Caroline asked about CBD oil. What's my perspective? I say go for it. You know, so many patients are being denied pain care. It's to me a great tragedy because bladder pain is rated equivalent to terminal cancer pain. I know I had it for 5 years terribly before I actually got better. I can't imagine going through that back when I was really struggling and not having access to pain meds. So if CBD oil gives you benefit, go for it. I've got some CBD lotion in my bathroom right now. But you have to make sure anytime you buy a CBD product, you have to make sure that it's organic. And you have the opportunity to look at the testing results, because what we have found in California, there is a very interesting case down in LA of a man who had been using CBD oil and medical marijuana. And actually, I don't remember which one. Anyway, he was using a medical marijuana product and he got dramatically sicker. And he felt like he was being poisoned. And so he took it on his own to have his medical marijuana tested. And he had bought it at a medical marijuana dispensary. And it was supposed to be a very good, safe brand. It was massively infused with pesticides. And he took his data to a TV station, and that TV station went in and did a much bigger survey and study and took lots of samples from all sorts of different brands. And what they found, even the brands that were labeled organic had pesticides in them. So their tip for CBD users and medical marijuana users is whenever you go into a dispensary, you need to see a testing results, and preferably a website where you can go and look at current testing results. You know, you have to, and again, I live in California, and so, and what is California known for, especially Northern California, is a really robust marijuana industry. And even today, even though it's legal today, when they find these illegal grows in national parks, there's massive rat poison that's killing all the wildlife and massive pesticides. Where is that marijuana going when it's being harvested? It's going to dealers, and some of it's being bundled to companies. So we want to look for a marijuana vendor who grows their own marijuana. They're not buying it from an outside source, where there's good lab testing to verify and prove that it is not contaminated with rat poison and pesticides, okay? Justin asks, a diatomaceous earth, hun, that would have absolutely no role in this at all. There's no reason to try diatomaceous earth with this, given the subtypes. Remember, our biggest subtype is injury, trauma. There's no reason to take diatomaceous earth in that situation, and it would not reach the bladder anyway if it is a bladder injury. I don't know of any way that it would do that. It would stay in your gut. Kathy asks, hydrodistension, do you recommend it? Yeah, you know, I mean, I said this before earlier. I don't want anybody guessing. I have no interest in anybody guessing about my health. If I'm in pain, if I'm bleeding, I want somebody to look and tell me why I'm bleeding. And there comes a point when hydrodistension is important. So typically, if you were to go to a national IC doctor, they don't do a hydrodistension right away. What they would do is they would examine your muscles. They would talk about your symptoms. They would look at your history. And unless there was something really dire, like visible blood in their urine, they would give you the diet. They would give you the supplement and or step 2 interventions, and they would send you on back and say, come back in 3 to 6 months. And the majority of patients with step 1 and step 2 treatments usually start to improve. If you've got a typical bladder injury, or and you start protecting your bladder and modifying your diet, you're giving your bladder a time to heal and an opportunity to heal. And that's, and so that patient is going to start steadily improving with that. However, if you get worse, if you're not responding to therapy, if your pain is escalating, bladder pain is escalating, pain as your bladder fills with urine is escalating, that's when the doctor should want to look in your bladder, and you want them to look in your bladder, because we need to know why. Do you have a Hunner's lesion that is not being, that nobody found earlier, that needs treatment? Or in a case from last year that was so fascinating, we had a woman who had had symptoms for years. She was afraid of the hydrodistension. She was afraid of a plain cysto, but her symptoms got so bad, she finally let the doctor look in her bladder. And what did they find? A giant kidney stone, so big that it could not pass, and it was cutting her bladder. They've been floating around in her bladder for years. And once they got rid of the kidney stone, they broke it up. Her bladder well healed, and she was symptom-free. So there comes a time when, if you're not getting better, letting somebody look is important. However, you also have to be educated about a hydrodistension, because we no longer do, the American Urology Association no longer recommends a high-pressure, long-duration hydrodistension. And this is my little slideshow on the AUA treatment. And the last slide in this is treatments no longer recommended high-pressure hydrodistension, right? In the old days, 10 years ago, 20 years ago, 50 years ago, they thought the more you stretch the bladder, the better. But we then learned that when you stretch the bladder, you can break the bladder, and the bladder can rupture, and that's not necessarily a good thing. So now what the American Urology Association recommends as step 3 intervention for IC is a low pressure, short duration. So instead of stretching up the bladder like mad, what we're doing is just putting enough fluid in there to allow the doctor to get a good look at your bladder, but they're not doing a lot of it and holding it in there for a long period of time. So if you're considering a hydrodistension, you need to have a discussion with your doctor about how he or she plans to do it. Will it be high pressure or low pressure? If he says high pressure, then what you're going to say is, well, doctor, the American Urology Association says they don't recommend high pressure anymore. I would like a low pressure, short duration. I don't want you to traumatize my bladder. I want you to look at my bladder and see if the doctor knows about the guidelines and see if the doctor's willing to do it. I had one done last year, piece of cake. It's a piece of cake. And I did not have a hydrodistension in 1993 when I was diagnosed. And the reason why I didn't is because I'd had exploratory surgery instead. But my urologist at the time said, there's no reason to traumatize you. I already know what you have. I'm sure of what you have. I've looked in your bladder twice with a cystoscopy. There's no reason to do a hydrodistension with cystoscopy and stretch your bladder. So there you go. Carol says, what do you think about CBD suppositories put in your vagina? Do you think they could help with pelvic pain? Carol, at the American Urology Association class on pelvic pain that was taught by Robert Moldwin, Jennifer Fariella Moldwin, and Robert Evans. You should know the names Rob Moldwin and Rob Evans because they are two of the top IC doctors in the United States. They specifically talked about, actually it was Jennifer Fariella, Rob Moldwin's wife, who talked about CBD suppositories. This is our summer 2018 IC Optimist, and you'll see there's a story inside AUA. I did a big summary of the class on AUA, and it came up, and let me read you what. Here we go. So this was in the discussion of vulvodynia that Jennifer Fariella Moldwin taught. And she said, medical marijuana was first used in patients struggling with multiple sclerosis in a double-blind placebo-controlled study. It decrease nocturia 30%. And nocturia is urination at night, getting up to urinate at night. How? Because the bladder contains cannabinoid receptors, making it a viable target for treatment. Medical marijuana acts to inhibit directly on the smooth muscle of the bladder. It has been delivered directly into the bladder as azulemic acid in research studies. Ms. Fariella Moldwin shared that they are seeing great success using medical marijuana suppositories, specifically mentioning Fairwind's cannabis-infused vaginal suppositories known as Feminine Relief and rectal suppositories known as Rectify. I don't know if you can see that pullout quote. They are seeing great success using MMJ suppositories. But again, you've got to look at the testing results. You don't want to put pesticides and rat poison in your vajayjay, right? You got, make sure the brand is really reliable. Let's see. I know I missed a question here. Alfalfa tabs, again, Kathy, I got no data on that at all. Sarah says she gets heparin, lidocaine, solucortef, sodium bicarb, gentamicin installations once a month. So that's really the most popular bladder installation that's used right now. I think it's time for a giveaway. Don't you think we need a giveaway? What do I have to give for 2019? Isn't that interesting? How about a bottle of Cysto Renew? Let's do, as a giveaway, a bottle of Cysto Renew. So I am going to write a number down. Oh, and somebody told me you could see me writing numbers. So hold on a sec. I'm going to write a number down. Okay, I'm trying to hide my arms because she said she could see what I was writing. You know what? I might have done this number already. Hold on. I don't want to be predictable here. Okay. All right. So the first person to say that, to write this number is going to get a free bottle of Cysto Renew. Okay. So you can guess between a 1 and 100. If you want a bottle of Cysto Renew, go ahead and guess. YouTube is guessing. Facebook, keep going. Not yet. You can vote it. You can just keep putting numbers in. You don't have to do it just once. Feel free to put more numbers in. Faith Green. Faith Green is the first to give the correct number, which is 33. I don't believe anybody before that did 33. I'm going back through this. Yeah, Faith Green, you have won a bottle of Cysto Protect. So Faith, what I need you to do is, if you are my friend on Facebook, can you send me your mailing address? And if my name is Jill Heidi Osborne, you can send me a friend request, or if you can send me your snail mail address to icnetwork@mac.com. Where is it? icnetwork@mac.com, or I will actually look for you online also, okay? And we will make this happen, my dear. All right. Any other questions? Any other questions? Last call for questions. Last call for questions. Carol says, should you use the pelvic suppositories over the rectal suppositories? Boy, the vaginal suppositories are kind of intentioned for women. The rectal suppositories were kind of intentioned for men, but you talk to your doctor about that. Connie's asking about baking soda and water. Using a 1/4 teaspoon of baking soda and a glass of water is a quick and easy way of reducing acid in your urine. But baking soda is sodium, and if you do a lot of it, you can raise your blood pressure. And so that is a typical way of alkalinizing your urine, but we wouldn't want you to do it more than once a day. And if you have any questions about it, talk to your doctor about it. If you have high blood pressure, it might not be something you would want to do. So talk with your doctor. Last call for questions. Last call for questions. Turmeric with black pepper. You know, that's a hard question to ask. There are some patients who are black pepper sensitive, and there are some patients who aren't. There are some who are turmeric sensitive, and there are some who aren't. It's really something where you just have to try it and see how you do with it. I wish I had a better answer for you. We have been working for the last 6 months with a new company on a new supplement line that is really exciting. And we've got some really good doctors that are helping. I can't say, I'm not allowed to talk, I'm not allowed to give you the brand name yet, but it's going to be a series of supplements that will do where you can kind of customize the right formula for you based upon what you're personally struggling with. And I know we've been talking about turmeric in one of those. All right. Okay, my friends, listen, 2019, it's a wonderful new year filled with new opportunity, new opportunities to try new treatments, new opportunities to practice self-discipline, if you're one of those patients where you just really never really bought into the diet and you're in pain, why the hell not try it? Just give it a shot. Come on. You got nothing to lose but pain. So if you haven't tried diet, play with your diet this year. Play with your diet right now. And go on the IC diet for a month or 2 months or 3 months and see if that helps, especially if you're IC subtype 1, subtype 2. I love New Year's because as I've gotten older, I've learned not to dwell on the past. I've learned not to, we call it catastrophize and ruminate about the wrongs that were done to me. You know, it's like, I'm sorry, it's done, it's over. I don't want to invest my precious time right now rehashing things that hurt. I want to focus on doing things that will help me. So every day I give you homework. Do one thing for your spirit and your soul. You got to do something that nourishes you individually. Okay, that's number one. I don't care what it is, but find something that will give you comfort, give you joy, put a smile on your face. I don't want you to suffer in silence at home alone with the drapes closed. Open up your drapes, walk out into the sunshine. There's no shame and no blame because you've got IC. And, you know, that's one of the things that really brings out the holidays. I'm sure some of you out there really dealt with some family members who did not believe you. They discredited you. They talked down to you. They suggested that it was all in your head. I don't want you to hide because somebody doesn't know what IC is. I want you to kick their butt. There is no shame. There is no blame for this. You are hurt. You are injured. You are no different than somebody who got hit by a car. And the gift of IC, if there's a gift of IC, is that you will never, ever, ever walk away from someone in pain anymore because you know what it's like to be alone in pain. I argue that an IC patient actually has more love to give. They have more kindness to give because we know what it's like to suffer alone. If there's somebody in your family who's hurt, you're going to be there for them. I know you are going to be there for them because you don't want anybody to go through the isolation that you have gone through. So if you're coming out of the holidays with people who have messed with you, I want you to hold your head up high. I want you to say to yourself, give yourself some really good daily affirmations. I can do all things. Every day in every way, my life is getting better and better and better. Be bold and mighty forces shall come to thy aid. You can throw in religious affirmations. You can throw in just believe, spiritual affirmations. I want you to look yourself in the mirror at the end of the day and be proud of who you see because you have never worked as hard as you are working right now. It is hard to live with pain. It is hard to live with discomfort. It is hard to have a condition that is embarrassing because it's your bladder. It'd be so much easier if it was a freaking broken shoulder, right? It's like, yeah, it's my shoulder. Everybody's like, okay, get it. So sorry you're going through that. You say you got a broken bladder? People are like, oh, come on now. You just drink lemon juice, so go away. Do what my mom did. Okay? So the point that I'm trying to make here is this a new year. Stand up, put your shoulders back, look people in the eye. Don't apologize about it. Ask for help when you need it. Ask your family to give you the support you deserve. Ask your doctor for information. Get out there and kick some butt. I want you to kick ass. I don't want you to suffer in silence anymore. Now, there's something that I learned in an anxiety management class that I took that I want you to do. For those of us who grew up never learning how to fight for ourselves, you're like, I want to kick butt, but I don't know how. I don't know how to do that. I don't know how to advocate for myself. When I walk into a doctor's office, I start crying, right? Okay. In this anxiety management class, what they said is, pretend you're somebody else when you walk in. Pretend, find somebody that you admire and ask yourself, how would that person handle this situation? When you walk into the doctor's office, pretend you're that person, right? So I want you to pretend, I'm not saying you need to admire me, pretend that you're me when you walk into a doctor's office. And what would okay. Or when you're in family. So if I have a family member who says, you know what, Jill, I just don't believe you. It's all in your head. This is what I would say. I would say, come with me. Let me show you the research. Let me show you pictures. Let me show you a video of what a bladder looks like that's bleeding. You might not believe me, but would you believe a picture? Walk them right into the website, walk them right over to the IC network and show them the videos. We've got videos of Hunter's lesions. They are undeniable. And then you say to them, now look at this bladder bleeding. How do you think this patient feels? Do you think it hurts? Oh, hell yeah, it hurts bad. It hurts terribly. So I don't want you to disrespect me anymore. This is what I'm dealing with. I need your help. I need your encouragement because honestly, if it were you, I would be there for you. I want you to be there for me. I need you to be there for me. If I have a moment where I'm having trouble, I'm in so much pain that I can't drive to the doctor, would you please drive me to the doctor? If we have a family birthday coming up and you want to do it at a restaurant, can we please do it at my house? Can you come to me on those moments when I'm not feeling well? Let it all out, my friends. Let it all out. You know what? There's no shame. There's no blame. I don't want you carrying shame or blame in any way, shape, or form. And if a doctor has the audacity or an emergency room has an audacity to say that IC isn't real, that it's all in your head, what I want you to do is I want you to come here. The American Urology Association website, auanet.org. If they're a urologist, they're already a member of that. In the upper right-hand corner of this page is a link that says guidelines. Go to that link, click it, go to the guidelines page, scroll down and look at the interstitial cystitis guidelines. Click at it. I want you to print it out. I want you to print 3 copies out, one for you, one for your doctor, and one to carry around if you ever have to go to an emergency room for an IC flare. You walk in with the AUA guidelines for IC, nobody can tell you it is all in your head. And the odds are they don't even know it exists. They've been around since 2011. There are urologists who still have never read that document. If you read that document, which is 45 pages, I think it's 45 pages long, maybe 50 pages long, you will know as much as the best doctors in the world know, and it's all supported by research. And it's wonderful. It's in statements. They make different statements. And so statement 1 about pain care and all this sort of stuff. And the AUA guidelines are remarkably compassionate and supportive when it comes to pain care. If you are struggling with pain relief, you print out those guidelines and you give them to your pain doctor because it talks about compassionate pain care. They want your pain assessed at every appointment. They want pain treated. They support the use of opiates, but they also support the use of other things too. Like if you got untreated Hunter's lesions, for God's sake, you don't just take the opiate. We got to treat the freaking lesion in the first place, because if we treat the lesion, you won't need the pain meds, right? So the best thing that you can do for 2019 is print out these guidelines, 3 copies, one to your doctor, one for yourself, and one to carry with you for any occasional emergency visits. You want to kick butt? You're kicking butt with the research, and that's critically important. All right, my friends, I wish you peace and joy and healing and love and hope for 2019. Join me on Sunday. We're having our first scheduled IC support group meeting this Sunday, 12:30 Pacific time, and I hope you'll join us then. All right? Okay, my friends, big hugs to you. I wish you well. If you have any questions, you know who to call. Jill Osborne at the IC Network. Make sure that you subscribe to our YouTube stream and like our Facebook page and share it with as many others as we can. Alrighty. I wish you well. Well, let me see if there were any last questions here. Is Sister Renew shellfish derived? I don't believe it is. Hold on. There's no seafood warning. I mean, it does not have glucosamine in it, and it's usually the glucosamine that is shellfish related. So I do not see that on their bottle. You can always call the company Douglas Labs and ask them, douglaslabs.com. Carol says, how did we make out in the fires? The closest fire was about 2 miles away from our house. On the worst day of the year, with the winds blowing to our house, but luckily the helicopters and the planes caught it in time. It was a brutal year, and we're kind of dreading the next year, but I'm going to practice positive thinking. No catastrophizing. So I just catastrophize. So I have to visualize my stop sign, a nice slow deep breath in, out. And then remind myself, I'm not God. I can't predict the future. And for all I know, it could be a great and no fire year in 2019. But so thank you for asking. Sherry, I think you'll really like the Bella Rosa coffee. All right. And let's see here on YouTube. All right, my friends, that's it. I got work to do. See you later. I got a whole bunch of patients to call. See ya. Bye-bye. On YouTube, I'm holding on here because I need to delete some comments here. So anybody on YouTube, if you're still here, if you have any questions, feel free to ask. I just need to go through this and get rid of the things that were posted by these ridiculous people. I think we got them all. Yes, we did. All right, YouTube. See you later.